विकास की नींव होती है उसकी युवा शक्ति। वह देश जिसका युवा आत्मनिर्भर है, स्वस्थ है, उस देश का विकास निश्चित है। जिस देश का युवा सशक्त नहीं है, बीमार है, उस देश का विकास नहीं हो सकता। भारत एक विकासशील देश है। वह अन्य देशों के मुकाबले कई मामलों में अग्रणीय है, परंतु भारत के लिए एक चिंता का विषय है अस्वस्थ युवा। वह युवा जिसका जीवन अभी शुरू भी नहीं हुआ है, वह रास्ते की शुरुआत से ही थका हुआ और बीमार है। वह कई मामलों में दूसरों पर निर्भर है। जानते हो दोस्तों, ऐसा क्यों है?
इसका सबसे बड़ा कारण है बाजार में मिलने वाली खाद्य वस्तु में मिलावट। आज बाजार में उपलब्ध ज्यादातर चीजें मिलावट का शिकार है, जैसे कि मिठाइयाँ, बेकरी और अन्य पकवान। इन सब में ट्रांस फैट की मात्रा काफी अधिक होती है। अगर आप सोच रहे हैं कि ट्रांस फैट क्या है, तो मैं आपको बता दूं कि ट्रांस फैट एक गंदे तरह का तेल होता है जिसे आम तेल में हाइड्रोजन डाल के बनाते हैं। इससे खाद्य वस्तु में उपयोग अवधि यानी कि शेल्फ लाइफ बढ़ जाती है और इन्हें ज्यादा दिन तक इस्तेमाल किया जा सकता है। एक समय था जब खाद्य पदार्थ शुद्ध देसी घी में बनते थे, परंतु आज उनकी जगह ले ली है ट्रांस फैट और अनसैचुरेटेड फैट ने। ट्रांस फैट हमारे स्वास्थ्य के लिए बहुत हानिकारक होता है और इससे कई खतरनाक बीमारियां जैसे कि हार्ट अटैक, ब्रेन स्ट्रोक जिसे लकवा हो सकता है, मधुमेह या डायबिटीज की बीमारी और कई अंगों के कैंसर हो सकते हैं। भारत में आज 60 से 70 हजार लोग हर साल ट्रांस फैट युक्त भोजन के सेवन से मरते हैं। इन सभी गंभीर लक्ष्यों को सोचते हुए पीजीआई चंडीगढ़ ने ट्रांस फैट फ्री दिवाली मुहिम चलाने का निर्णय किया है। यह एक और इस मुहिम के दौरान हम ट्रांस फैट से होने वाली बीमारियों के बारे में जागरूक करना चाहते हैं। जब भी तो आप ये ध्यान दें कि मिठाइयाँ देसी घी या शुद्ध तेल की बनी है, उसमें मात्रा कम हो। अब हम कैसे पता करेंगे कि ट्रांस फैट की मात्रा कम हो? ट्रांस फैट की मात्रा कभी भी हम कोई सामान खरीदे बाजार से, उसमें 2% से नीचे ट्रांस फैट की मात्रा होनी चाहिए। हम तेल की बोतल खरीदते हैं, हम बिस्किट, नमकीन या फिर बेकरी के प्रोडक्ट्स खरीदते हैं, इसमें ट्रांस फैट की मात्रा 2% से नीचे होनी चाहिए। अगर हम इन छोटी छोटी बातों का ध्यान रखेंगे तो हम अपनों को और अपने परिवार को स्वस्थ रख सकेंगे। धन्यवाद।
एक तो बाल ऐसे हो जाते हैं।
दोस्तों, किसी भी राष्ट्र की नींव होती है उसकी युवा शक्ति। वह देश जिसका युवा आत्मनिर्भर है, स्वस्थ है, उस देश का विकास निश्चित है। जिस देश का युवा सशक्त नहीं है, बीमार है, उस देश का विकास नहीं हो सकता। भारत एक विकासशील देश है। वह अन्य देशों के मुकाबले कई मामलों में अग्रणीय है, परंतु भारत के लिए एक चिंता का विषय है अस्वस्थ युवा। वह युवा जिसका जीवन अभी शुरू भी नहीं हुआ है, वह रास्ते की शुरुआत से ही थका हुआ और बीमार है। वह कई मामलों में दूसरों पर निर्भर है। जानते हो दोस्तों, ऐसा क्यों है?
इसका सबसे बड़ा कारण है बाजार में मिलने वाली खाद्य वस्तु में मिलावट। आज बाजार में उपलब्ध ज्यादातर चीजें मिलावट का शिकार हैं, जैसे कि मिठाइयाँ, बेकरी और अन्य पकवान। इन सब में ट्रांस फैट की मात्रा काफी अधिक होती है। अगर आप सोच रहे हैं कि ट्रांस फैट क्या है, तो मैं आपको बता दूं कि ट्रांस फैट एक गंदे तरह का तेल होता है जिसे आम तेल में हाइड्रोजन डाल के बनाते हैं। इससे खाद्य वस्तु में उपयोग अवधि यानी कि शेल्फ लाइफ बढ़ जाती है और इन्हें ज्यादा दिन तक इस्तेमाल किया जा सकता है। एक समय था जब खाद्य पदार्थ शुद्ध देसी घी में बनते थे, परंतु आज उनकी जगह लेनी है ट्रांस फैट और अनसैचुरेटेड फैट में। ट्रांस फैट हमारे स्वास्थ्य के लिए बहुत हानिकारक होता है और इससे कई खतरनाक बीमारियां जैसे कि हार्ट अटैक, ब्रेन स्ट्रोक जिसे लकवा हो सकता है, मधुमेह या डायबिटीज की बीमारी और कई अंगों के कैंसर हो सकते हैं। भारत में आज 60 से 70 हजार लोग हर साल ट्रांस फैट युक्त भोजन के सेवन से मरते हैं। इन सभी गंभीर तथ्यों को सोचते हुए पीजीआई चंडीगढ़ ने ट्रांस फैट फ्री दिवाली मुहिम चलाने का निर्णय किया है। यह एक महीने की मुहिम है और इस मुहिम के द्वारा हम ट्रांस फैट से होने वाली बीमारियों के बारे में आपको जागरूक करना चाहते हैं। जब भी आप बाजार से मिठाइयां खरीदें तो आप ये ध्यान दें कि वो मिठाइयां शुद्ध देसी घी या शुद्ध तेल की बनी है, उसमें ट्रांस फैट की मात्रा कम हो। अब हम कैसे पता करेंगे कि ट्रांस फैट की मात्रा कम हो? ट्रांस फैट की मात्रा कभी भी हम कोई सामान खरीदे बाजार से, उसमें 2% से नीचे ट्रांस फैट की मात्रा होनी चाहिए। हम तेल की बोतल खरीदते हैं, हम बिस्किट, नमकीन या फिर बेकरी के प्रोडक्ट खरीदते हैं, उसमें भी ट्रांस फैट की मात्रा 2% से नीचे होनी चाहिए। अगर हम इन छोटी छोटी बातों का ध्यान रखेंगे तो हम अपनों को और अपने परिवार को स्वस्थ रख सकेंगे। धन्यवाद।
चाहिए होगा
दोस्तों, किसी भी राष्ट्र की नींव होती है उसकी युवा शक्ति। वह देश जिसका युवा आत्मनिर्भर है, स्वस्थ है, उस देश का विकास निश्चित है। जिस देश का युवा सशक्त नहीं है, बीमार है, उस देश का विकास नहीं हो सकता। भारत एक विकासशील देश है। वह अन्य देशों के मुकाबले कई मामलों में अग्रणीय है, परंतु भारत के लिए एक चिंता का विषय है अस्वस्थ युवा। वह युवा जिसका जीवन अभी शुरू भी नहीं हुआ है, वह रास्ते की शुरुआत से ही थका हुआ और बीमार है। वह कई मामलों में दूसरों पर निर्भर है। जानते हो दोस्तों, ऐसा क्यों है?
इसका सबसे बड़ा कारण है बाजार में मिलने वाली खाद्य वस्तु में मिलावट। आज बाजार में उपलब्ध ज्यादातर चीजें मिलावट का शिकार हैं, जैसे कि मिठाइयाँ, बेकरी और अन्य पकवान। इन सब में ट्रांस फैट की मात्रा काफी अधिक होती है। अगर आप सोच रहे हैं कि ट्रांस फैट क्या है, तो मैं आपको बता दूं कि ट्रांस फैट एक गंदे तरह का तेल होता है जिसे आम तेल में हाइड्रोजन डाल के बनाते हैं। इससे खाद्य वस्तु में उपयोग अवधि यानी कि शेल्फ लाइफ बढ़ जाती है और इन्हें ज्यादा दिन तक इस्तेमाल किया जा सकता है। एक समय था जब खाद्य पदार्थ शुद्ध देसी घी में बनते थे, परंतु आज उनकी जगह लेनी है ट्रांस फैट और अनसैचुरेटेड फैट में। ट्रांस फैट हमारे स्वास्थ्य के लिए बहुत हानिकारक होता है और इससे कई खतरनाक बीमारियां जैसे कि हार्ट अटैक, ब्रेन स्ट्रोक जिसे लकवा हो सकता है, मधुमेह या डायबिटीज की बीमारी और कई अंगों के कैंसर हो सकते हैं। भारत में आज 60 से 70 हजार लोग हर साल ट्रांस फैट युक्त भोजन के सेवन से मरते हैं। इन सभी गंभीर तथ्यों को सोचते हुए पीजीआई चंडीगढ़ ने ट्रांस फैट फ्री दिवाली मुहिम चलाने का निर्णय किया है। यह 1 महीने की मुहिम है और इस मुहिम के द्वारा हम ट्रांस फैट से होने वाली बीमारियों के बारे में आपको जागरूक करना चाहते हैं। जब भी आप बाजार से मिठाइयां खरीदें तो आप ये ध्यान दें कि वो मिठाइयां शुद्ध देसी घी या शुद्ध तेल की बनी है, उसमें ट्रांस फैट की मात्रा कम हो। अब हम कैसे पता करेंगे कि ट्रांस फैट की मात्रा कम हो? ट्रांस फैट की मात्रा कभी भी हम कोई सामान खरीदे बाजार से, उसमें 2% से नीचे ट्रांस फैट की मात्रा होनी चाहिए। हम तेल की बोतल खरीदते हैं, हम बिस्किट, नमकीन या फिर बेकरी के प्रोडक्ट्स खरीदते हैं, उसमें भी ट्रांस फैट की मात्रा 2% से नीचे होनी चाहिए। अगर हम इन छोटी छोटी बातों का ध्यान रखेंगे तो हम अपनों को और अपने परिवार को स्वस्थ रख सकेंगे। धन्यवाद। दोस्तों, किसी भी राष्ट्र की नींव होती है उसकी युवा शक्ति। वह देश जिसका युवा आत्मनिर्भर है, स्वस्थ है, उस देश का विकास निश्चित है। जिस देश का युवा सशक्त नहीं है, बीमार है, उस देश का विकास नहीं हो सकता। भारत एक विकासशील देश है। वह अन्य देशों के मुकाबले कई मामलों में अग्रणीय है, परंतु भारत के लिए एक चिंता का विषय है अस्वस्थ युवा। वह युवा जिसका जीवन अभी शुरू भी नहीं हुआ है, वह रास्ते की शुरुआत से ही थका हुआ और बीमार है। वह कई मामलों में दूसरों पर निर्भर है। जानते हो दोस्तों, ऐसा क्यों है? इसका सबसे बड़ा कारण है बाजार में मिलने वाली खाद्य वस्तु में मिलावट। आज बाजार में उपलब्ध ज्यादातर चीजें मिलावट का शिकार है, जैसे कि मिठाइयां, बेकरी और अन्य पकवान। इन सब में ट्रांस फैट की मात्रा काफी अधिक होती है। अगर आप सोच रहे हैं कि ट्रांस फैट क्या है, तो मैं आपको बता दूं कि ट्रांस फैट एक गंदे तरह का तेल होता है जिसे आम तेल में हाइड्रोजन डाल के बनाते हैं। इससे खाद्य वस्तु में उपयोग अवधि यानी कि शेल्फ लाइफ बढ़ जाती है और इन्हें ज्यादा दिन तक इस्तेमाल किया जा सकता है। एक समय था जब खाद्य पदार्थ शुद्ध देसी घी में बनते थे, परंतु आज उनकी जगह ले ली है ट्रांस फैट और अनसैचुरेटेड फैट में। ट्रांस फैट हमारे स्वास्थ्य के लिए बहुत हानिकारक होता है और इससे कई खतरनाक बीमारियां जैसे कि हार्ट अटैक, ब्रेन स्ट्रोक जिसे लकवा हो सकता है, मधुमेह या डायबिटीज की बीमारी और कई अंगों के कैंसर हो सकते हैं। भारत में आज 60 से 70 हजार लोग हर साल ट्रांस फैट युक्त भोजन के सेवन से मरते हैं। इन सभी गंभीर तथ्यों को सोचते हुए पीजीआई चंडीगढ़ ने ट्रांस फैट फ्री दिवाली मुहिम चलाने का निर्णय किया है। यह एक महीने की मुहिम है और इस मुहिम के द्वारा हम ट्रांस फैट से होने वाली बीमारियों के बारे में आपको जागरूक करना चाहते हैं। जब भी आप बाजार से मिठाइयां खरीदें तो आप ये ध्यान दें कि वो मिठाइयां शुद्ध देसी घी या शुद्ध तेल की बनी है, उसमें ट्रांस फैट की मात्रा कम हो। अब हम कैसे पता करेंगे कि ट्रांस फैट की मात्रा कम हो? ट्रांस फैट की मात्रा, कभी भी हम कोई सामान खरीदे बाजार से, उसमें 2% से नीचे ट्रांस फैट की मात्रा होनी चाहिए। हम तेल की बोतल खरीदते हैं, हम बिस्किट, नमकीन या फिर बेकरी के प्रोडक्ट्स खरीदते हैं, उसमें भी ट्रांस फैट की मात्रा 2% से नीचे होनी चाहिए। अगर हम इन छोटी छोटी बातों का ध्यान रखेंगे तो हम अपनों को और अपने परिवार को स्वस्थ रख सकेंगे। धन्यवाद।
A very good morning to everybody. I welcome all the faculty and senior experts who have joined the event. We will be starting in another 2 minutes.
कि दिखाना है, ये रूल है। उसके बाद जब टाइम होगा, अपॉइंटमेंट होगा तो दे देंगे।
Good afternoon, one and all. On behalf of Department of Community Medicine and School of Public Health, PGIMER Chandigarh, in collaboration with Strategic Institute for Public Health Education and Research, SIPHER, and Global Health Advocacy Incubator, GHAI, I, Dr. Kritika Upadhyay, Documentation and Research Officer, welcome all the delegates to the virtual valedictory event of Trans Fat Free Diwali campaign. Trans fats, also known as bad fats, have been proven as one of the major risk factors for cardiovascular diseases worldwide. India is a country with wide variation in food habits, and trans fatty acids being one of the dietary sources in the form of fried food and snacks. In many parts of India, hydrogenated vegetable oil in the form of vanaspati is consumed in great quantity, which is also known to have the highest content of trans fats. Diwali. Diwali is one of the most famous festivals of India, which not only bring happiness and excitement among the people, but also enhances the intake of trans fat among them in the form of sweets, frozen food, fried food, and many more. Trans fat in the form of partially hydrogenated oil increases during this festive season in our country, and which ultimately increases the risk of cardiovascular diseases and hypertension. With this background, a one-month campaign was launched on 21st of October 2020, and the campaign gained its summit, which you will witness during the event. The campaign has worked toward how to avoid trans fat, how important is reading labels, capacity building of community health officers, strengthening the health and wellness center, and generating general public at large through social media, print, as well as electronic media. And there are many more interactive activities conducted during the campaign. This campaign definitely helped in disseminating the awareness regarding the harmful effects of trans fat, not only at the state level, but has also spread its wings at the district, block, and even at the village level. I'm happy to share that many Bollywood celebrities, international level athletes, sport persons, singers, and medical experts have joined us and supported the campaign. I want to say the end of the story is a new beginning for many others. So I put my heartfelt gratitude to all the eminent guests and ambassadors who have come ahead and joined the hand for making this campaign a success. And I welcome all our audience for this event. Thank you. With this, I request Dr. Amarjeet Singh, who is head in Department of Community Medicine and School of Public Health, PGIMER, Chandigarh. He has published more than 170 research articles, co-authored more than 20 books, and more than 300 publications. His areas of interest are health promotion, women health, and elderly health. And he has published several books, including Demedicalization of Women Health, Care of Dependent and Elderly, Salutagenesis, and many more. Besides, he is a recipient of the prestigious Harcharan Singh Oration of IAPSM. I welcome you, sir. I request you to please address the audience and deliver the welcome address. Over to you, sir.
Okay, thank you, Dr. Kritika. सलाम, नमस्ते, सत श्री अकाल सबको मेरी तरफ से, हमारे डिपार्टमेंट और संस्थान की तरफ से। जैसा कृतिका ने बोला, मैं अभी डिपार्टमेंट ऑफ कम्युनिटी मेडिसिन पब्लिक एक महीने का जो कैंपेन चला, जो ट्रांसफैट फ्री दिवाली का, अभी आज उसका कल्मिनेशन है। तो इसमें मेन इश्यू ये है कि सबसे बड़ी बात जो हम सब याद रखें कि ये सिर्फ एक महीने की एक्टिविटी अभी आज खत्म हुई है। ये मतलब नहीं कि अभी कैंपेन हमारा खत्म हो जाएगा। ये एक महीने में सिर्फ हम कई बार ऐसा वर्ड यूज करते हैं, फ्लेक्सिंग द मसल्स। अभी तो थोड़ा जैसे मेन कुश्ती शुरू होती है, उससे पहले जोर आजमाइश होती है, थोड़ा एक दूसरे से कस बल पहलवान आपस में देखते हैं। तो डॉक्टर सोनू की
Yeah, Kritika, I think we have lost Dr. Amarjit, maybe some technical issue.
Okay, sir. We may move ahead till the time he joins. So I invite Dr. Sonu Goel to address the audience.
So am I audible?
Yes, sir. So Dr. Amarjit has joined. So, sir, please.
So, was I audible earlier?
Yes, sir.
सो बात फिर से चालू करते हैं। कनेक्शंस का प्रॉब्लम जब से वर्चुअल मीटिंग्स का शुरू हुआ तो ये रह ही रहा है। तो आई थिंक जो मैं बात कर रहा था उसमें यह है कि डॉक्टर सोनी की खास बात ये है कि एक जैसे किसी काम को करने का बीड़ा उठाया तो उसमें पहले सब लोगों को साथ लेके चलना, तो इन सब डिग्निटरीज को साथ में लाना एक बड़ी उपलब्धि है, बड़ा अचीवमेंट है। तो अभी जस्ट एक शुरुआत है। तो ये कैंपेन ये नहीं है कि एक दिन में एक महीने में हुआ खत्म हो जाएगा। ट्रांसफैट वाली बात, जो ट्रांसफैट फ्री दिवाली एक सिर्फ एक उसका बानगी या एग्जाम्पल था, तो वो अभी हुआ और ये चलता रहेगा। क्योंकि इसमें हमें ये याद रखना चाहिए कि हम अपनी जो भारतीय संस्कृति है उसे भूल जाते हैं, और जो एक बड़ा पिछले कई 40-50 सालों से डिसइंफॉर्मेशन कैंपेन चल रहा है। जब हम एमडी कर रहे थे अर्ली 80s में, तो ऐसा हमने शोर सुना कि देसी घी सेहत के लिए बुरा है, मक्खन नहीं खाना चाहिए, या साउथ इंडिया वालों को बोला गया कि कोकोनट ऑयल बेकार है। तो ये आपको शायद सबको मालूम होगा कि ये सारी विद ड्यू रिगार्ड्स अमेरिका की उपज है। ट्रांसफैट का जो शुरुआत की थी इन्होंने, वेजिटेबल ऑयल लाए, पहले तो लार्ड और ये बटर फैट यूज होता था, बाद में ये ले आए। और मैंने अपने एक सेशन में पहले बोला था, फ्रैंकेस्टीन जैसा एक राक्षस पैदा कर दिया है खुद ही हमने, अब उसको हम मारने की कोशिश कर रहे हैं। तो बैक टू बेसिक असली चीज है कि हमें वापस अपने उस पर जाना चाहिए। उसमें मैंने सिर्फ 2-3 बातें ये कहनी है कि हम रिप्लेसमेंट की बात कर रहे हैं, जैसे डॉक्टर सोनू अभी वीडियो में हमने सबने सुना, तो ये सबके लिए देसी घी पॉसिबल नहीं होगा। लेट अस फेस दिस फैक्ट। तो जो गरीब जनता है, जो आम पब्लिक है, मिडिल क्लास लोग हैं, वो क्या खाएंगे? देसी घी, और जो सो कॉल्ड अमीर हैं वो देसी घी से वैसे ही नाक मुंह चिढ़ाते हैं। आजकल के बच्चे देसी घी, मलाई, मक्खन तो खाते नहीं ज्यादा। तो ऑप्शन क्या रहेगा? तो सबसे पहले हमें रिप्लेसमेंट ऑप्शन ढूंढना चाहिए। उसमें जो लिटरेचर में आ रहा है, ओलिव ऑयल में बड़ा शोर है। ओलिव ऑयल क्या इंडिया के लिए ओके है? आई डोंट थिंक सो। तो बाकी ऑप्शन मूंगफली ऑयल है, कैनोला ऑयल की बात करें तो अभी तक हमारे पास, मेरे ख्याल से हम इस मुहिम में जुड़ गए हैं, रिप्लेसमेंट या अल्टरनेटिव की बात सीरियसली सोची नहीं गई है। फिर हम अगर देसी घी की बात करें, ठीक है भाई, जो बड़े हलवाई हैं या ऐसे लोग हैं, सिंधी स्वीट्स हैं, ऐसे वो लोग देसी घी में बेचेंगे, लोग खरीदेंगे। जो रेडी लगाता है वो देसी घी में कैसे टिक्की तल के आपको देगा? सो दीज आर द थिंग्स वी शुड कंसिडर। ऑप्शन क्या है हमारे लिए, वो कमर्शियली वायबल इंडस्ट्री में, चाहे वो रेडी लगाता है स्ट्रीट पे, रेस्टोरेंट में या होटल में, शादियों में, सब जगह वायबल न्यूट्रिशन वाले फील्ड वाले लोगों को ये आई थिंक काम करने की जरूरत है इंडिया के लिए। बाकी देश जो करते हैं करते रहें, हमें अपने देश के लिए जो करना वो करें। तो इसमें एक चीज जस्ट मैं कहूँगा कि जहाँ संजय चतुर्वेदी, शायद आप जानते होंगे, प्रोफेसर एंड हेड कम्युनिटी मेडिसिन, यूनिवर्सिटी कॉलेज मेडिकल साइंसेज दिल्ली में हैं, तो वो काफी कुछ लिखते रहते हैं। तो मैं उनकी एक कविता आपसे मतलब बिना परमिशन लिए और उनसे जो फेसबुक से चोरी करके पढ़ रहा हूँ, तो मुलाहिजा हो। तो ये संजय चतुर्वेदी जी लिखते हैं, शयन आरती, कुफ्र में जिनने जायका मारा, वो खुदा का लगा खुदा मारा, एक लड्डू ने ले लिया ईमान, 2 कचौड़ी ने तूतिया मारा। पहला। दूसरा वो लिखते हैं, आज तूने हमें रुला मारा, कैसा सामान्य मुब्तला सारा, लाल लाल चटनी हरी हरी बातें, मिर्च मुश्ताक समोसा मारा। अगले पैरे में वो लिखते हैं, सनसनाती जलेबियां जादू, रंगे औसान दंदना मारा, बूंदियों में गुलाब का जामुन, खैच बशाश खलीफा मारा, उर्द की दाल दाल की दुल्हन, सो दही में दही बड़ा मारा, और अरहर गरम मसालों में जैसे उर्दू ने रेखता मारा, खीर मोहन फकीर मोहन। तो यहीं पे मैं बंद करूं। आधी कविता है ये, सिर्फ आपको डॉक्टर संजय चतुर्वेदी जो खूब लिखते हैं, एकेडमिकली भी, पब्लिक हेल्थ में भी, प्रोज भी, कविताएं भी, कहानियां भी, काफी सारी बुक हैं। तो ये सिर्फ ये बता रहा हूं कि जो हमारे इंडिया में जो खाने के प्रति, भोजन के प्रति जो एक सब लोग लजीज खाना या स्वादी खाना या सुबह से शाम तक कुछ ना कुछ अच्छा मिलता रहे पसंद करते हैं, तो ट्रांसफैट या कुकिंग मीडियम का उसमें अहम रोल है। तो उसके लिए ये हम बिल्कुल ध्यान रखें कि क्या ऑप्शन हम दे रहे हैं। सिर्फ अवेयरनेस और ये लॉ बनाने से कि कानूनी तौर पे बंद हो जाएगा, फिर उनसे जुर्माना वसूला जाएगा, वो असली चीज नहीं है। असली चीज है अल्टरनेटिव मेरे हिसाब से। तो इसमें अंत में सिर्फ इतना कहूंगा कि जितने भी ये मुहिम जो न्यूट्रिशन की चल रही है, ये सिर्फ एक पार्ट है, और इसमें वाइडर स्केल पे हम जैसे दूसरे पंजाब और चंडीगढ़ में स्ट्रीट वेंडर की ट्रेनिंग करें, उसमें भी ये एलिमेंट हम जोड़ रहे हैं। और मेरी तरफ से जो हमारे संस्थान के निदेशक हैं डॉक्टर जगत राम जी, उनको धन्यवाद कि वो एक्टिवली इस मुहिम से जुड़े डॉक्टर सोनू गोयल के आग्रह से। और हमारे डीन रिसर्च गुरप्रीत सिंह जी, वो भी इसमें शामिल होंगे इस वैलेडिक्टरी में, उनका भी धन्यवाद। और सारे जितने भी पार्टिसिपेंट हैं, राणा जय सिंह और बाकी, और जितने भी डॉक्टर सोनू की टीम, उनको मेरी तरफ से बहुत बहुत बधाइयाँ कि आपने इस टॉपिक को एक फोर फ्रंट पे ले आए हैं। जितनी जोर शोर से आप पब्लिसिटी कर रहे हैं वो काबिल तारीफ है। और इसके साथ साथ हमारे संस्थान और विभाग का भी नाम इससे आगे बढ़ता है, और इंटरनेशनल लेवल तक लोग इसमें फीडबैक दे रहे हैं। तो आप सबको शुक्रिया, धन्यवाद, और मेरी तरफ से बेस्ट विशेस, बधाइयाँ, धन्यवाद। और लास्ट में मेरी आदत है कि बोलना मैं बंद इतनी आसानी से करता नहीं। एक चीज और मैं कहना चाहता था कि सब कुछ करें, एक हाउसवाइफ या लेडी ऑफ द हाउस, या वो महिला, या आजकल तो आदमी भी किचन में पकाने लगे हैं, जिसका किचन पे कंट्रोल है, उनको भी इसमें रोप इन करें तो बहुत अच्छा रहेगा। और एक और चीज की, जैसे सेटिंग बेस्ड हेल्थ प्रमोशन की बात है कि स्कूलों में, यूनिवर्सिटी में जो कैंटीन है, जहाँ पे हमारा कंट्रोल है, कुछ जगह हमारा कंट्रोल इतना आसान नहीं, कुछ जगह जहाँ कंट्रोल कर सकते हैं, तो वहाँ पे वो जरूर हम ये जारी रखें कि वहाँ पे ट्रांसफैट फ्री आसानी से किया जा सकता है। और हाउस वाइफ को ड्यू इम्पोर्टेंस मुझे लगता है जितनी मिलनी चाहिए नहीं है, वो जरूर है कि घरों में जो पकता है, तो हाउस वाइफ को थोड़ी पावर तो है ही उनके पास ऑलरेडी, और इसमें इन्वॉल्व करें तो अच्छा रहेगा। धन्यवाद।
Thank you very much, sir. Thank you for deliberating on the important aspect and highlighting all the important aspect of trans fats. So, and also for starting with an unwavering, enthusiastic start for this event. So I further invite Dr. Sonu Goel, who is professor in Department of Community Medicine and School of Public Health, PGIMER, Chandigarh. He is director of a tobacco-based resource center, and also the project lead for SMHSP project. He has 70 years of rich experience in public health and health management. He is alumnus of John Hopkins School of Public Health, Baltimore, and Maastricht University, the Netherlands. He has been awarded as Public Health Excellence of India by Honorable Union Minister of Health and Family Welfare in 2014. And he is also Program Director for International Courses by Ministry of External Affairs. I welcome you, sir, and kindly throw some light on the campaign. Over to you, sir.
So very good afternoon to one and all. And I'm really privileged after a talk by Dr. Singh. He has already always been a very enthusiastic force for the department and individually for each and every faculty in the department. So thank you, sir, for such motivating words. So, and thanks to all the faculties and experts and our guest of honors who have joined this this campaign, the valedictory function of this particular campaign. So without taking much of the time, this campaign was started basically, as Kritika has told, on 21st October. And it was actually somebody, we did this entire campaign just by discussion within the team. It was not actually the part of project, but we discussed in the team that we are doing something on nutrition. And the team consisted of Dr. Poonam, who is in our department as Associate Professor of Nutrition, and all other members of the team, that since Diwali is coming, why don't we celebrate 1 month campaign and for making people aware about the importance of trans fat. So we were running something on trans fat, but why not doing this thing on that in campaign mode, in mission mode? So we discussed this thing with Principal Secretary Health, Shri Hussan Lal ji, and Shri Kumar Rahul ji, Commissioner, Food and Drug Administration, and they gladly accepted that why don't we extend this approach to Punjab. So they told that we do this trans fat free Punjab campaign in addition to trans fat free Diwali. So they accepted our idea, and that's what the thing started. And all the team were very enthusiastic. They approached various sports persons, singers, medical experts, and luckily for us, everybody whom we approached, whether it is people like Milkha Singh or other sports person or other experts, singers, they all gave us good support by giving their messages. Next slide. So then we did a lot of IEC material in terms of brochure, pamphlet, billboards, standees, banners. We did everything, and we displayed not only at the district level, but also at the village level. Till village level, we displayed all the pamphlet, billboards, and this thing in Punjab. And then this campaign was highlighted, and there was a dissemination of pledge in PGI as well as in other government departments. And we received a video message from, we involved media personnel, and I'm happy to inform you that we involved almost 15 newspaper people have actually collaborated with us. 4 or 5 electronic channel collaborated with us, and they did stories. Not only they did articles, but they did stories. And there was a special cyclothon where 50 cyclists, because we had in the COVID times, we could not have many people. So we did a cyclothon where 50 cyclists of mixed age groups spread the messages from PGI till Sukhna Lake. We did that. We also collaborated with Department of Education in Chandigarh, and they celebrated it. They forwarded our slogan writing and poster making competition in all the 150 schools of Chandigarh. And we received almost 1,000+ entries from various schools. Even our faculty colleagues in PGI contacted me that, Dr. Sahab, this is the poster my daughter, my son is making. So is it in the correct direction and all those things. Then we used EduSet to spread lecture about ill effects of trans fat at the school level in Chandigarh and Punjab. And then Weekend Runners Group, which was a marathon group, collaborated with us. Chandigarh Administration, Education Department, Municipal Corporation, Mohali, all these people collaborated with us. And then we approached the Radio Mirchi 98.3, and they liked the idea of disseminating the messages through this campaign, and they publicized this campaign throughout the entire month through their radio channel. So I think this is just, I would like to summarize here because I will not take much. We have made a small documentary in which the journey of trans fat free Diwali campaign, 1 month campaign, is being summarized in around 10 minutes, 8 to 10 minutes. So please have a look at that commentary.
Hello everyone. Over 77,000 deaths annually are attributable to trans fat consumption in India. As a premier institution that serves to public health, the figures are quite alarming for us. To call for an immediate action. It all started with an interaction with Principal Health Secretary Shri Hussan Lal, during which the need to eliminate the trans fats from our food cycle was highlighted. After discussing at length, the team of our project coined the idea of launching trans fat free Diwali.
Tried, बनाने की 2 hours ago.
Royal Field के सामने ये दो F250 वाला ID है.
Across the country,
F250
sweets and eating lots of fried foods. We thought of using this opportunity, launching the campaign so that we can benefit population. After being handed over with the idea, the Department of Community Medicine and School of Public Health launched and conceptualized it further and came up with a blueprint. Not to forget, the campaign was not possible without indispensable support of SIPHER, an advocacy-focused civil society, and Global Health Advocacy Incubator for the funding organization. The things were not easy as COVID pandemic was also walking along with us. Plan activities that do not put the health of our team members at risk. Now, we had a concrete plan which was waiting for grand inauguration. On October 21st, 2020, Principal Secretary of Health, Mr. Hussan Lal and Commissioner of Food and Drug Administration, transfer-free Diwali campaign in the state of Punjab. After the successful launch, it was time for execution of planned activities. The first and foremost step is the process was to develop the IC materials, brochures, pamphlets, billboards, standees, banners, and placards were placed and prepared in English, Hindi, and vernacular languages and displayed to the target audience, which serve the purpose of generating basic awareness from diverse audience. To disseminate the information among maximum people, we have listed down different mediums, including print media, electronic media, and social media. Print and electronic media helped us in reaching to the local and state audience. The social media introduced us to the entire globe. We also forwarded and followed a pre-planned strategy from which media persons in order to obtain maximum outcome. Apart from the press releases of various events, we also prepared a series of stories on different topics related to trans fat for the journalists, like what are trans fat, the labels, implementation of policies against elimination of trans fats in schools, health effects of trans fats, journey of trans fat globally and in India, association of salt and trans fat, and so on. And we would never be able to express our heartfelt gratitude to the media organization, including Indian Express, Hindustan Times, the Daily Pioneer, Chandigarh Savera, Dainik Bhaskar, Dainik Jagran, Amar Ujala, Ajit, and many other newspapers who agreed to carry the stories in newspapers. On electronic media, we disseminated our message to provide trans fats among masses with the organizations including
entire push to our campaign. The campaign ran on Twitter and Instagram. A number of people across the globe. We received a lot of encouraging comments on the social media from diverse audience. Apart from sharing the IC material, inviting prominent people for a small video message on eliminating trans fats from the field of cinema, sports, health and medicine brought some unexpected our campaign with support from celebrities like Hussan, Mr. Bubble Rai, Mr. Jasveer Jassi, Mr. Bain Singh Indar, Mr. Hemper Hussan Puri, many others. The Trans Fat Free Diwali campaign reached to a newer heights. With support of such prominent personalities, our campaign was unstoppable. For ensuring support public and creating awareness, organizing the cyclothon, which was flagged off by eminent dignitaries. We also organized inter-school competitions like slogan writing, poster making, jingle making in all public and private schools of Chandigarh. The use of EduSet to spread lectures about the effects of trans fat was also promoted. We received 1,000+ entries in different categories, which showed enthusiasm among students to eliminate trans fat from the food. Even the teachers and higher administration of the school was excited with the campaign and supported it wholeheartedly. We also provided cash prizes in each categories of the contest for their encouragement and harnessing health and wellness centers to aware general public regarding ill effects of trans fat was another key resource of the campaign. A pledge on Trans Fat Free Diwali plus health and wellness center operational across various districts of Punjab. IC material developed in various languages for disseminated and displayed in various telemedicine sites in different districts of Punjab. Three health and wellness centers were awarded with cash prize in the campaign. And Government of Punjab has proposed this initiative among the best practices in healthcare sector. A lecture on the effects of trans fats also vendors, and they also pledge to reduce trans fat in their food preparation. This is how we connected the dots with Trans Fat Free Diwali campaign in reality. For us, and first of its kind in the entire country and globe, where such type of campaign targeting audience across various sectors was planned and successfully accomplished. The team of our project left no stone unturned to make this event a grand success. I urge all of you once again to avoid trans fat in your food so that you can keep yourself and your family healthy and safe.
Thank you very much, sir. Thank you for taking us to a voyage of Trans Fat Free Diwali campaign through this documentary and comprising it in a concise and precise way. So moving further, our next session, you will hear our guest of honors, their golden words of wisdom very swiftly. So I invite our first guest of honor, RJ Mehak from Radio Mirchi 98.3, Chandigarh. So Mehak Chauhan is a radio jockey and content producer. She is the host of a show, Meethi Mirchi, on the city's most popular radio station, 98.3, rating number 1. She also wrote, produced, and acted in many digital audio videos and for the station and clients. Currently doing a series called Kitab Ki Awaaz for Mirchi Spoken Word on YouTube channel, Mirchi Scribbled, host of multiple high-profile events and for film promotions. So I welcome you, ma'am. Over to you. I request you to please share your experience during the campaign.
Hello, hi, good afternoon, everyone. Thank you so much for having me here. I am absolutely honored and I am so grateful that I could connect and I could be part of this beautiful initiative. It is very important to, of course, to spread awareness, and I believe radio is one of those media which is free of cost, does not need any subscription, and reaches more and more people. It doesn't matter what is the a class or financial status of a person who's listening to us. The information reaches all the corners of the society, and that is why, as a radio jockey, I feel it is my responsibility to, of course, because Radio Mirchi believes in infotainment, we believe in entertaining people, but we definitely believe in spreading information. We need to make the right information reach people, and awareness is something which is very important, especially about trans fat. And honestly, when I started interviewing the doctors for my show, it was a pretty long series of interviews that I did, but I am so happy that my show could do something so important for the society. And personally as well, I learned so much from all the doctors that I spoke to, and I have a huge respect for all the doctors and the whole team of PGI, especially Surbi, who connected me with the doctors. And I have to I'm extremely grateful to all the doctors who gave me their time and answered my sometimes very stupid questions as well, because we need to keep it very simple for the listeners, because radio does not have a repeat button or a forward or a rewind button. So we have to make it very simple and make it reach more and more people, so that in one go they understand what is more important. And they absolutely did. I have received such beautiful feedback from people, from my listeners who called in my show and absolutely shared their experience, that how their attitude towards the shopping list changed during Diwali. Whenever they went out to bring or to buy something, maybe the bakery products or the sweets, they made sure that the trans fat value is less than 2%. See, I remember that as well. And even recently, when I went for shopping, I made sure that I buy things with zero trans fat or trans fat less than 2%. So that is something that has definitely affected me. And I'm sure people who are connected to me personally have also been affected nicely by this. And thank you so much for doing this campaign. As a normal part of society, I am extremely grateful for other doctors who actually thought of it, because otherwise you can just let it be and not worry about the world, but that actually makes you different from the rest of the world. Your heart is pure and you want everybody's heart to be healthy, and they should avoid trans fat. So thank you so much for having me, and thank you so much for making me part of this, and I'm honored, truly honored. Thank you.
Thank you, Ms. Mehak. Thank you for such an encouraging words and for your constant support. We would be like to be the part with your channel in future also.
Absolutely.
Thank you. Thank you for giving your time. So this was RJ Mehak. Moving further, I invite our next guest of honor, Dr. Umesh Kapil. Sir is presently working in AIMS, Professor Clinical Epidemiology at Institute of Liver and Biliary Sciences, New Delhi. He was alumni of AIMS New Delhi. In view of his contribution in the field, he has been a recipient of 3 national awards from Indian Council of Medical Research. He was also elected fellow for National Academy of Medical Sciences, Indian Association of Preventive and Social Medicine, and many more. He has more than 50 research papers in his credit. We welcome you, sir. I request you to please address the audience.
Yeah. Good afternoon, all the participants. I am most grateful to Dr. Amarjeet Singh, Dr. Sonu, other dignitaries for participating in this particular program. I must admit that this is an outstanding initiative, and School of Public Health and Department of Community Medicine have been undertaking a large number of public health initiatives, and this is one of the important initiatives they have undertaken. This month-long campaign again was an outstanding work which has been undertaken by the department, and in which not only the health department but other departments like education, Municipal Corporation of Delhi, Radio Mirchi, and many more departments were included in this particular campaign. Now, this is true that the trans fat causes a number of chronic disorders, non-communicable diseases, and this is an important area. In fact, this is being undertaken by many organizations, and WHO India Country Office, WHO Zero Office have been trying their best that all the food labels which we have, of the packaged food, should have a label which should talk about the trans fat contents of the food which they are having or which they are selling per serving. And it has been very strongly being done that if the food has more than 2% of the uh, trans fat per serving, then it should have a different label. And we have done a lot of work in this particular area, and we try to collect almost 700 packaged foods and try to look into their trans fat contents, uh, which is we try to document it. I'll share it with Dr. Sonu, that findings of that particular research project. Now, what the most important thing is that even the government of India is taking a lot of efforts in this direction. Health Minister, Honorable Health Minister in 2019 released a logo which should be put on all the packaged foods. Now, again, there's a lot of industry resistance to put up these things because they are commercial impact of it. So what is happening is, to begin with, we have started, the government of India, in consultation with Food Safety Standard Authority of India, they have made this logo as a voluntary exercise, and maybe over a period of time this will become mandatory. Now, similarly, we do have a Fit India movement, a Eat India Right movement, and this Eat India Right movement also have the Honorable Prime Minister had talked about in his Mann Ki Baat that we should take care of the uh, uh, trans fat, and particularly the foods which are contain the high amount of trans fat. Now, Indian foods, particularly the Indian sweets, the bakery products, they do have a large amount of trans fat, which is a serious issue. And what can be done about it? Now, we are not able to, still struggling with the document that how much of trans fat causes the non-communicable disease, the CAD, hypertension, how much quantity of trans fat per day causes these issues. But bottom line is, smoking is bad, whether it's a 1 cigarette or 5 cigarettes. Same is true. The trans fats are bad for the all non-communicable diseases. So we have to ensure that we should initiate a campaign so that there's a reduction in the trans fat in our food. One of the most common food items which have this trans fat are essentially these potato chips, uncle chips, auntie chips, and so many other chips are there, which do contain trans fat, and we need to curb this. We have to ensure that although we keep on talking about the reduction in fast foods, but unfortunately, it's so difficult to practice because the messages which are being given by these commercial organizations gets the imprint on the minds of the young children, and they want it, whether it is adolescent, whether it's a young child, they need it. Now, important issue is the single frying doesn't make trans fat in the oil. It's a repeated frying at the high temperature which leads to generation of trans fat. We must remember that. And in fact, because of the pressure which has been developed or the evidence which has been developed by the WHO and by different scientific organization, the even the McDonald, they have said that we are not making these our foods, particularly the fries, as using the trans fat oil. This is something very important, and we must remember that we need to talk about these issues at the more at the commercial level, because maximum amount of trans fats are produced by the commercial or industries which are taking part of it. Looking back into the history of Vanaspati, if you I was just going through the history of Vanaspati. What happens that oil is in oil form, it's a liquid form, but what we do is we hydrogenate it so that it solidifies, and once it solidifies, it's helpful in the transportation. We have our army people, we have CRPF and many other organizations which are far-flung areas, and they need to have fat for their preparation of their food. And this was done way back in 1950s, that as Dr. Amarjit Singh rightly pointed out, it was done, the process was initiated by USA, and that has been adopted by our country. In 1940s and early 50s, nobody was consuming fat enough, vanaspati in our country, but then it was introduced. And everybody wanted that anything which is operationally feasible, user-friendly, and that was got into our culture. Now, with this background, I would like to congratulate Dr. Sonu and the PGI team for taking this initiative. And it's something which is wonderful which they have done. They have utilized all modes of communication, messages. They have roped in all the eminent personalities in and around Chandigarh, as well as some film celebrities. They should be congratulated for taking this initiative. Thank you very much for giving me this opportunity, Dr. Sonu and Dr. Amarjit Singh. Thanks a lot.
Thank you very much, sir. Thank you for such encouraging words and enduring our audience through the different dimensions of Transfat. Thank you very much, sir. Now, I just wanted to tell the audience that we have thought of doing an assessment regarding the knowledge and perception and the practices of trans fat. So our team is sharing a link on your chat box, a Google link in the YouTube chat box. So you just can click on the link and fill that form. Also, our team is continuously sharing the social media handles. So you can just click on the link and like our pages and can access to all the videos and all the events which we are continuously doing under the project. So moving further, I request our next guest of honor, Professor Dr. Ravi Mehrotra. He is the CEO Program Lead of the India Cancer Research Consortium and an adjunct professor of epidemiology at the Rollins Institute of Public Health, Emory University, Atlanta. He is a member of Scientific Council WHO IARC. Earlier, he led the ICMR National Institute of Cancer Prevention and Research, as well as the WHO FCTC Global Hub on Smokeless Tobacco. His skills and expertise include translational clinical research in cancer, tobacco, control, and implementation science. He has more than 350 research publications under his name. I welcome you, sir. I request you to please share a few words of wisdom with the audience. Over to you, sir. Professor Ravi Mehrotra, sir, can you hear us?
Thank you so much. really appreciate your program for the last 1 month that you have been doing with the trans. I've been following your social media as well. It is a proud privilege and honor to be part of this particular program, especially around the time of Diwali, which is in India is one of the biggest festivals, and that is where the maximum utilization of sweetmeats does happen. And I know that a lot of these sweetmeats do contain more than the permissible amount of trans fat. So this was probably a very opportune time to have this particular campaign, as Sonu has rightly mentioned. So under the leadership of the School of Public Health and SIPHER and various media, as well as sports, as well as film personalities that we have got, I personally feel this is one of the best campaign that I have seen in the last few months or years, not only on trans fat, but on any area of public health. So because quite often we as policymakers, researchers and physicians and scientists, we have all the right ideas, but we can write papers in journals, we can do interviews, we can have conferences. It is uncommon and probably most important that it is implemented in real life. So when really awareness and also needs that kind of a goading, it has to come from easier than scientists and doctors. I mean, no way trying to decrease the importance of scientists and doctors, but they are the source of communication. But as I go along with years and my experience, I feel that connecting with the individual on the ground level is probably more important. I can publish 25 articles in the topmost journals of the world, whether it is Lancet or BMJ, but if the results don't really trickle down to the man on the street, to the woman in the street, it is not really very useful. It may be an ego massage for me, may get me promotion, may get me prizes, but if what I say and what we as a community talk about gets really transformed and becomes part of the policy, part of the daily life of individuals in public health, I don't think anything could be more important. I really love the idea of using these personalities, whether it is media, advertisement, or sports, because they are the people youngsters especially look up to, and rightly so. But also using the radio, as our Honorable Prime Minister has been doing, using the radio need of communication in his Man Ki Baat, which is, I think, a first in today's age in social media who listens to the radio. But surprisingly, the radio still has the kind of reach which no other media has. Even in the remotest of villages, not only in Punjab, but all over India, it is listened to by a variety of people. I was in a car about an hour ago and I was listening to the radio as well. So having the radio jockey for Radio Mirchi and very say, is in addition to disadvantages, a lot of advantages too. So when we talk about people becoming couch potatoes or not really exercising enough, of course, that is true to a certain extent. But these are the kind of programs which will really get the awareness into the masses. So once again, let me congratulate all of you in the team as in this valedictory function. I know it couldn't have been easier. And also I would like to make a suggestion to the SIPHER and the PGI School of Public Health team, if they have not heard about it, that now that you have this experience, you will please write it up in a medical journal or public health journals for others to use it as a method how to do a good campaign. Evaluate the program as how well it has done using standard markers. And also now, instead of making it a trans Punjab campaign, make it trans India. Because we as a country would talk about and we transfer the kind of importance which it should, and combined with other social causes and public causes, including tobacco, alcohol, and trans fat, and of course, even the use of salt in food. These are the four sort of pillars that we always talk about. But maybe if we can have a combined strategy and a separate strategy as well, depending on the audience, it would be a really useful thing. At the Indian Council of Medical Research, especially in the Cancer Research Consortium, would very much like to team up and help in any which way we can. Thank you so much for your very kind attention. And once again for calling me. It is my proud privilege. Over and out.
Thank you. Thank you very much, sir, for appreciating the efforts. And I totally agree with you that putting words into action is very important. And as you said, that we should actually put this campaign through the media journal. So definitely, sir, we are already in the process of writing an article over this. And hopefully we will be able to publish it. Thank you, sir. So I request our guest of honors that we are running behind the time. So please be swift with their words. So I request our next guest of honor, Dr. Rana J. Singh. He is the Deputy Regional Director, International Union Against Tuberculosis and Lung Diseases, New Delhi. He has immense experience in the domain of tobacco control and is a master trainer for courses of mid and senior level managers and is currently supporting tobacco and NCD control program in Southeast Asia region. Sir has 25 years of rich experience and he is master trainer of senior level managers. So over to you, sir. I welcome you and please welcome the guest.
Yes, thank you, Dr. Pritika. Can you hear me? Am I audible?
Yes, sir. Yes, sir.
Yes. So again, like everyone, so first of all, I would like to congratulate Professor Amarjit Singh and his team led by Dr. Sonu Goyal. Then Dr. Rakesh Gupta and team of PGIMER and SIPHER on organizing this month-long multi-dimensional education campaign on trans fat free Diwali in state of Punjab, which is perhaps one of the most highest prevalent state for various NCDs, including hypertension. So, lot has already been said about uniqueness of this campaign, and I also really find it very, very comprehensive. So, what we found in this campaign that there was an advocacy component, sensitization of stakeholder, youth involvement, stakeholder responsible to provide us food. So they were also involved. The people who are really responsible to do this. Excuse me, there is some disturbance. Then media, excellent involvement of media, which we just saw in the presentation, and ultimately general population. So I think that is why this campaign was really unique. And I would also like to submit that among all risk factors of NCDs, perhaps unhealthy diet has not got full attention either on policy sides and effectively implement the current policies and guidelines we have. There are some guidelines, there are some policies as far as healthy diet is concerned, but still I think we are far away. All the previous speaker has already mentioned that their implementation is really very, very, I think, poor. So only I will like to give a few messages. One is, and this is a uniqueness, unique for the state of Punjab. One is focus on rural populations. You see, all the studies, most of the studies in our country, which has been done to look at prevalence, in rural and urban population, they have found that prevalence of hypertension and cardiovascular diseases is more in urban areas. But Punjab, you see, few studies which have come from Punjab, a study by Dr. Mitra and others from Amritsar, they have found that Amritsar district has a rural prevalence of hypertension is higher than urban population. Similarly, a very big step survey done by Dr. Thakur and Dr. Tripathi of PGIMER Chandigarh. They also found that in rural populations, the prevalence of hypertension is comparable to the urban population. And perhaps that is because of equalization of urban and rural divide, which is there in other states. So in state of Punjab, we find that that divide is now almost negligible. So I would suggest that once we start our implementation part, and when we are already doing that, special program should be constituted or developed for rural population. Second is definitely the part in when we are discussing about hypertension, delay in diagnosis and treatment. So that is again our rural population are especially at risk. So in addition, as Dr. Amarjeet Singh mentioned, every stakeholder should be involved. Food, just like tobacco, no one can say that I am not a stakeholder. Whether the person is preparing food, whether it is serving food, whether the people are using that. So, and Dr. Amarjeet very rightly he has mentioned that women of the house is perhaps most responsible person which need to be educated, which need to be involved. So that is a very, very important message which he has given. And let's see how we can see that when we are working on healthy diet, free from trans fats, how we can involve them. And then definitely role of Food and Drug Administration is very, very crucial to educate as well as to enforce the existing laws. So I won't be saying too long about what are trans fat, etc. And I think already Dr. Umesh Kappal has mentioned very, very clearly his experience of last many years, very, very comprehensive way. So thank you once again, and congratulations to all the team of PGIMER and SIPHER. We would be very happy to work further on this aspect, and I convey my commitment from the union also to be involved in any such initiative in future also. Thank you. Over to Kritika.
Thank you, sir. Thank you for highlighting the uniqueness of the campaign, and we will look forward to the suggestion, your valuable suggestions. So thank you very much, sir.
Thank you.
I again repeat that we are moving behind the time. I request all the guests of honor to be very crisp. I request now Dr. Sanjay Zorpe, our next guest of honor. He is Vice President, Academics, Public Health Foundation of India, New Delhi, and also holds leadership position in the as director at Indian Institute of Public Health, New Delhi. He also served as director of Indian Institute of Public Health at Gandhinagar and Bhubaneswar. Recently, he has been appointed as the board member of Routine Health Information Network, Boston, USA. He's the chair of Research Advisory Council of National Institute of Miners Health, Ministry of Mines, Government of India. And he has been active member of INCLIN and many other institute and association. So I request Dr. Sanjay Zorpe that our audience is keen to listen from you, and I request you to please deliberate on the topic. Thank you, sir. Over to you, sir.
Thank you. Thank you so much for this generous introduction. And at the outset, let me congratulate Professor Sonu Goel and Professor Amarjeet Singh for this very innovative campaign. I will not speak about the relevance and importance of trans fats and particularly in the context of non-communicable diseases. But this campaign has been very innovative. When I looked at the earlier communications shared by Professor Goel about this trans fat-free Diwali campaign, I saw its relevance not only in the context of Punjab and Haryana, and as being rightly mentioned by other speakers also earlier, that next time we must try to ensure that we scale up this. It has several initiatives. One is that it has several important and good characteristics, is that it is scalable. What has been demonstrated as a case study, I would say, as an important public health intervention, is that this can be taken up by different identified institutions in India on lines that the PGI has taken this forward, and also in different states. That's number one. Number two is that one of the another unique feature of this particular campaign that which I could see was it's a completely multi-stakeholder engagement. Social media being used, print media, electronic media is being used. There's an engagement of NGO sector, bureaucracy is involved. We have people from academia and research institutions participated. We have representation and participation from the cinema and sports also. The point I'm making is that this is very unique from that perspective of involving multiple stakeholders and see their engagement in advancing the advocacy of some public health intervention, which is a brilliant example of what we say is that science is sterile if it lacks the social relevance, and policy would crumble on clay feet if they are not firmly placed on a pedestal of valid science. Because research is merely a tool. What ultimately benefits to the society is the knowledge, and knowledge that we generate through our academic and research engagement. We need to see that how do it get translated into the benefits to the society. And this is the wonderful example in that particular context. Because when we talk about knowledge, it has two components: knowledge generation and knowledge translation. Knowledge generation gives you the thrills of discovery that we identify several interventions play an important role. But the knowledge translation actually gives you a satisfaction of purpose being fulfilled. And in that context, I would say the relevance and importance of this particular campaign, which is very important. I would also encourage Professor Amarjit Singh and Professor Sonu Goyal, because we are hosting at PGI the National Conference of Indian Association of Preventive and Social Medicine. And in that conference, actually, we showcase this campaign that this is an important public health intervention, could be a case study for our whole IAPSM colleagues also. And if during that conference we can identify, 10, 20, 25 institutions like PGI for the next Diwali for that matter, then that would be important. And what Professor Amarjit Singh has rightly mentioned, this cannot be a cross-sectional activity. This cannot be a one-time activity. It has to be a longitudinal and it needs to be carried forward. And joining hands, professional associations, Professor Sanjay Rai would also be speaking today, but both our IAPSM and IPHA associations can definitely provide a platform to take these kind of an initiatives further forward. And in that context, I would like to congratulate PGI, but also would like to congratulate the strategic initiative for public health education and research SIPHER at Chandigarh and Global Health Advocacy Incubator at USA, who also join hands because multiple stakeholders need to join hands in advancing this important initiative. So thank you so much, and my best wishes for taking this further forward. Thank you for this opportunity.
Thank you very much, sir. Thank you for encouraging words. And we definitely agree with you on the knowledge generation and knowledge translation, which this campaign has successfully done. And we will also consider the valuable idea of using this as a case study in the upcoming IAPSM conference. Thank you very much, sir. So I request our next guest of honor, Professor Sanjay K. Rai. He's president of Indian Public Health Association and currently at the Center of Community Medicine, professor at the Center of Community Medicine, All India Institute of Medical Sciences, New Delhi. He has over 100 publications to his credit and is reviewer of several national and international journals. He has been a principal investigator and co-investigator for more than 25 research projects. He is involved in research on human influenza disease with the Center of Disease Control, Atlanta, and he's a member of many technical and expert groups. I welcome you, sir, to please address the audience. Over to you, sir.
Thank you very much. I know we are already behind schedule and I will not take more than the 3-minute allocated time. So a very good afternoon, all the resource person attending this virtual validity session. Ladies and gentlemen, first of all, I would like to thank organizers for having me here to participate in this validity session of Trans-Fat-Free Diwali campaign. I would also like to congratulate Dr. Amarjit Singh, Professor Sonu Goyal and his entire team of Department of Community Medicine and School of Public Health for covering an important issue of public health through a unique way. I will not talk about here the relevance of this already. Dr. Umesh Kapilja, Dr. Sanjay Jodhpe, and many others have already covered this. So really, friends, it's very heartening to note that the Department of Community Medicine and School of Public Health at PGIMER Chandigarh has conceptualized this and successfully also implemented the trans-free Diwali campaign. Really, it's a great that a festival like Diwali, where we eat sweet, we purchase a lot of sweet. So this festival was selected to implement this campaign. As all of you know, that Diwali is one of the most popular festivals celebrated in almost all part of our states and union territories with equal enthusiasm. I'm also happy to know that the awareness regarding the harmful effect of trans fat was just limited to the cities. Even the village level was introduced, and this was a really unique campaign, I can say. Also, healthcare workers at different level were included in the implementation process. Friends, we all know there is no doubt that trans fat are one of the commonest cause of cardiovascular disease throughout the world. And campaign like this will help to create awareness among general public regarding the adverse effect of these agents and replacement with the healthier fats. And I again acknowledge the contribution by the Department of Community Medicine and School of Public Health, and wish them all the best in the similar future endeavors. And I fully agree with Dr. Sanjay Jodhpek. You must showcase this in your next conference. Thank you very much. Thank you.
Thank you very much, sir. Thank you for enlightening our audience and to be very precise with time. Thank you, sir. I request now our next guest of honor, Dr. R. Himlata. She couldn't join this event because of her other commitments, but she has sent a message across to the audience. So, ma'am is Director, National Institute of Nutrition.
Except calories, trans fatty acid consumption does not add any value to our food or provide any nutrients, but causes many health risks. Regular consumption of trans fatty acids can alter lipid profile, causing dyslipidemia, cause endothelial dysfunction. It decreases insulin sensitivity and thus may lead to diabetes. It is also known to cause breast cancer, colon cancer. Then among pregnant women, preterm births, preeclampsia, and also in the newborns, it has been shown to cause disorders of nervous system and problems in vision. Studies conducted at NIN showed that chronic consumption of trans fatty acids induces progression of non-alcoholic fatty liver disease. Then even 2% energy intake from trans fatty acids is known to induce insulin resistance. And among pregnant women, 1% energy intake per day is also known to predispose the offsprings to insulin resistance in adult life. And restricting the intake of trans fatty acid during pregnancy is that much more important. Eliminating trans fatty acid from the diet is known to confer health benefits, including reduction of CVD-related incidence and mortality. And most of these health risks associated with trans fatty acid consumption has been attributed to inflammation, oxidative stress, then lipid peroxidation due to high levels of trans fatty acids in the plasma. Then what are the foods that are associated with the high consumption of trans fatty acids in our routine? It is bakery products or sweets or fried food stuff, savories made with using partially hydrogenated vegetable oils that are high in trans fatty acid levels. In 2006, WHO recommended that trans fatty acid intake should be less than 1% energy, that is 2 grams per day per person, consuming if you consume 2000 calories per day, and suggested a global phasing out of trans fats. Following this, a national consultation on trans fat regulation was held at NIN on 29 Jan 2010. In the meeting, NIN and FSSAI concluded that trans fatty acid content of the vegetable oils should be less than 10%, and also it was decided to gradually reduce the level of TFA. Accordingly, FSSAI implemented the trans fat regulation from July 2013 and proposed to reduce the trans fats to 2% in partially hydrogenated vegetable. Current regulation permits up to 5% in partially hydrogenated vegetable. Trans fat intake should be zero, and also it is important to develop new technologies for hydrogenation of oils which should produce zero trans fats, at the same time preserve the desirable properties. This is very important. And it is not only the responsibility of the regulators, but it also should be the responsibility of other stakeholders, including consumers. We should make commitment to avoid consumption of trans fatty acid-rich foods such as sweets, savories, and bakery stuffs made with partially hydrogenated vegetable oils that are high in trans fatty acids. And for better health, and we should also strive towards a healthy and progressive India. Thank you. Except calories, trans fatty acid consumption does not add any value to our food or provide any nutrients, but causes many health risks. Regular consumption of trans fatty acids
Thank you very much. I thank ma'am for sending this message across. So I request our next guest of honor, Dr. Rubina Shaheen. She is Director Standards at Food Safety and Standard Authority of India. She has served thrice as Health Officer, Srinagar Municipal Corporation. Besides, she was posted as a Program Manager, National Health Mission, Jammu and Kashmir. Her areas of interest are microbiology, infectious disease, public health, and many more. I request you, ma'am, to please address our audience, and over to you, ma'am. Dr. Rubina? Ma'am, we can't hear you. I think you are muted. Yeah. Dr. Rubina, can you hear me? Till the meantime, I request our next guest of honor, Professor Dr. Gurpreet Singh, Dean Research PGIMER. Sir has rich experience of more than 25 years in surgery. His areas of interest include breast diseases and surgical oncology. He's a recipient of Dr. C.M. Singh Memorial Oration 2017 of Punjab chapter. And also he has been written 160 research papers in international and national journals. Over to you, sir. Dr. Gurpreet Singh. We'll be happy to hear you, sir.
Thank you very much. I think a lot of things have been said about trans fats. So I'm going to keep it very brief. First of all, let me congratulate Dr. Amarjeet Singh and Dr. Sonu for doing this public campaign, reaching out to the grassroots level. I think it is very important to at least the first step in doing any kind of preventive activity is to create awareness about it. And I think this will go a long way in creating awareness in the public. One of the core principles of community medicine is that an ounce of prevention is better than a pound of cure, and we all believe in that. Primary prevention is the way to go if we want to look out also the health economics. Primary prevention will be much better than treating so many patients who develop diseases because of bad nutrition. Being a cancer specialist, I am especially happy that you are talking about bad cholesterol and trans fats, because a good healthy diet will help in the primary prevention of cancer also. So not only is it going to look at cardiac diseases, prevention of cardiac diseases, vascular diseases, but also going to look at prevention of at least reducing the incidence of cancer. So thank you, Dr. Sonu, Dr. Amarjeet, for carrying out this campaign and inviting me for this function. Thank you very much.
Thank you very much, sir. And thank you for such encouraging words and highlighting the other ill effects apart from cardiovascular and hypertension. Thank you very much, sir, for giving your time. Dr. Rubina, if I'm audible to you, you may please address the audience.
Yeah, am I audible now?
Yes, ma'am.
Yeah. So, good afternoon, all, and it's an honor for me to address such a wonderful audience on behalf of FSSAI. And particularly, I like to thank Dr. Sonu for inviting me on this occasion. So, as we know that WHO has called for elimination of trans fat by 2023 and has launched the Replace Action Package, which actually serves as a roadmap for countries to implement action towards elimination of industrially produced trans fat. So since this is a dietary risk factor, as we all know, and so elimination of trans fatty acids from food supply is one of the priority targets for WHO and is more feasible and achievable target. So our country, India, has also been progressing towards its objectives of trans fat elimination by 2022, a year ahead of the global target by WHO. And FSSAI is also committed to reduce the industrially produced trans fats from food products from present 5% to less than 2% by year 2022 in a phased manner. And we have geared up to get freedom from trans fat with the motto that India at 75, freedom from trans fat. So I really feel happy that with these objectives in mind and this 1 month long trans fat free Diwali campaign, which has been organized by the Department of Community Medicine and School of Public Health, PGI, is a way forward to achieve the set targets. So as we know that PGI Chandigarh has, being a reputed institute, has always been hellbound to provide quality care to patients and also work for the community. And under the banner of this Department of Community Medicine, the institution has already been doing a lot of work to develop better public health services and better community activities. So such campaigns will definitely help to create awareness not only among the policymakers, but also among the food manufacturers and general public, and provide them the information about the negative impacts of trans fat. Before I complete, I would like to congratulate the whole team of PGI and to conduct this wonderful campaign, and also their support partners, that is the Strategic Institution of Public Health and Education and Global Health Advocacy Incubators on this achievement. So I hope that similar such campaigns and activities will be carried out in future under the Eat Right India initiative of FSSAI as well. So finally, I really congratulate all, particularly the team who has been all the way involved in this campaign. Thank you so much.
Thank you very much, ma'am. Thank you for being so supportive. And we definitely want to thank the FSSAI because on their footsteps, we have actually launched this campaign. And we definitely wanted to support the Eat Right, Eat India movement. Thank you very much, ma'am. And I also wanted to thank our special guest, Mr. Radesh Kalra, Joint Director, Local Government Punjab, who also joined this meeting. And he has been actively involved in Urban Livelihood Mission and helped the vulnerable population. And he has given a consent that he will be incorporating trans fat in future in his all projects. So thank you very much, sir. So I further continue that our chief guest, Shri Hussan Lal ji, Principal Secretary, Department of Health and Family Welfare, couldn't join us because of his urgent meeting regarding COVID-19 with the Chief Minister of Punjab. But he has sent a message across, which I'll be reading for you, that Punjabis are known for their intake of rich diet, might be sitting on a trans fatty acid time bomb. Numerous studies have shown that 40% of the Punjabi population is overweight or obese. Considering the alarming figures, the government of Punjab is committed to take all necessary action in accordance with the guidelines listed by FSSAI to reduce trans fat in oils, fats, and food products. This is why we do not think twice while extending our support to Trans Fat Free Diwali campaign. And he appreciates the PGIMER, SIPHER, GHAI for his joint effort in launching the Trans Fat Free campaign that has encouraged the Punjab to become a healthier state. And as our state is highest, as he said, that Punjab has the highest prevalence of high blood pressure, high cholesterol, and high blood sugar in the country. Efforts should be made to reduce the use of trans fatty acids by creating awareness about its ill effect to the healthy population. So I thank you, sir, in absentia, that your words are absolutely remarkable, and we will be working in the elimination of trans fat under your panel. Thank you, sir. Now I request Dr. Om Prakash Pera. He is India Country Coordinator for the Cardiovascular Health Program. He works closely with the diverse coalition of civil society partners on the development and implementation of strategies to improve hypertension control and reduce trans fat. He has collaborated with a variety of regional and national government actions in public health issues like tuberculosis, epidemic management, and NCDs. He has worked with International Union Against Tuberculosis and Lung Disease, Vital Strategies and Foundation for Innovation, and Global Fund to Fight AIDS, Tuberculosis, and Malaria. So I request Dr. Om to please give the overview of the status of trans fat in India. Over to you, sir.
Thank you so much. First of all, I would like to congratulate all the team in PGI for having such a wonderful campaign. From conceptualization to implementation, everything was like excellent. And this campaign, like in my knowledge, this campaign is one of the first of its kind at the state level for trans fat elimination, and like catering to a host of stakeholders, which includes from school children to geriatric population. So everybody was included. And at the same time, the different modes of media that were taken. So that was like another uniqueness of the project. Going ahead with the trans fat regulation, as was communicated by Dr. Rubina from FSSAI, I echo to the same part. Like still now, we have a lot to do related to trans fat regulation implementation. Even at 5% regulation implementation, there has been reports from states of like high cardiovascular burden related to implementation challenges. So I think this type of campaign builds the brings out the best, and brings out the best part of having such a good campaign. And on a bigger front, the policymakers and the implementers do get a clear-cut idea like about the subject, about the burden, about the regulation. And going ahead, India will be moving into 3% regulation and a 2% regulation by 2022 in a phase-wise manner. But the learnings from 5% trans fat implementation, that will be crucial for implementing a 2% campaign itself in 2022. It involves stakeholders from partially hydrogenated oil manufacturers to the consumers, and in between a lot of variety of stakeholders. So it becomes important. I would say this is the first tone and this is the first campaign which connects to the consumers, which sensitizes the consumers, as well as like it brings great details about why trans fats should be avoided. But at the same time, we should keep in mind the bigger target and a bigger public health responsibility on our shoulders to convey to the public and to sensitize the public about the 2% regulation that is that will eventually come. So we are hoping for a 2% regulation by 2022. That is like a document at India at 75, and hope so. This type of campaigns will be launched by multiple states, and that can gear up the entire implementation part. As we know, implementation is related to bigger and better resources and bigger and better understanding of the subject. So thank you so much, and glad to be in a part of this campaign.
Thank you very much, sir. Thank you, Dr. Om. Actually, I should appreciate that you were the one who kickstarted this campaign, and we are very thankful for the support of your organization, GHAI, and we are ready to take the bigger target on our shoulders with your support. So thank you very much. Now I request our next speaker, Ms. Parul. She is correspondent Indian Express Chandigarh. She has an experience of over 20 years as a reporter, writer, editor, and a rewrite person in the Indian National Daily and the Indian Express. A consistently dependable team player, thrives in a high-pressure environment and enjoys the challenge of meeting deadlines and managing a team. Her areas of interest are researching, writing, and editing on a wide range of subjects. We are happy to have you, ma'am. So stage is yours to speak on media perspective of trans fat pre-Diwali campaign. Ma'am, please be very swift with your topic. Over to you, Ms. Parul. Can you hear me? Ms. Parul, please unmute yourself. I think Ms. Parul has been disconnected. There has been internet issues. So we can further continue with our session. So I invite Dr. Rakesh Gupta, President and Director of Public Health Strategic Institute of Public Health Education and Research. Sir has been a former Director Health Services and Director of Chemical Examiner Lab Punjab. He's alumni of Johns Hopkins School of Public Health, Baltimore, and University of California, San Francisco. He has received various awards, including WHO Award in 2015. So I hand over the stage to Dr. Rakesh for gratituding the ambassadors. Over to you, sir.
Yeah, thank you, Kritika. So thank you. These two words, they express gratitude, humility, understanding, as well as acknowledgement. I'm here with you because I just want to say all that. Without the indispensable support of our ambassadors, the journey of Trans Fat Free Diwali campaign would never have been successful. I would like to thank all the ambassadors who extended their support to Trans Fat Free Diwali campaign, and it is very humbling. You all made it a mass movement. More than 30 celebrities from the field of sports, films, and Punjabi music industry, they joined us in the campaign. And today we had the privilege to connect to some of the ambassadors, and we can never thank them enough for honoring us with their presence. And then I would like to introduce the ambassadors who are with us. I think they are with us. Mr. Byan Singh, athlete. Mr. Tejinder Singh Toor, he is also an athlete. Mr. Brijesh Ahuja, playback singer. Amita Marwaha, social worker. Mr. Dinesh Mohan from film industry. Ms. Priyanka, who is a yoga therapist, and RJ Mac, who has already talked about it. So from Radio Mirchi, and Jasbir Jassi, singer, he may be with us. So thank you all ambassadors, and over to Kritika.
Thank you very much, sir. We will be talking to them shortly. Before that, we will be displaying a documentary prepared by all the messages which we have received over the campaign by these ambassadors.
और बहुत बहुत प्यार। तो मैं सबसे ये कहना चाहता हूँ कि आप जो बाहर की चीज है वो दिवाली और दशहरे के दिनों में मत खाएं। तो लोगों को आदत होती है मिठाई खाना, ये चीज वो चीज खाओ, तो उससे क्या होता है कि 20 बीमारियां लगती हैं। तो मैं आपसे यही कहूंगा कि दिवाली के दिनों में इन चीजों से आप मिठाई वगैरह से बच के रहें, ना खाएं, ताकि इन चीजों के पास आप ना जाएं तो अच्छा रहेगा। गोल्ड मेडलिस्ट अर्जुनावादी ट्रांसफैट जो कि साढ़े जल्दियां बीमारियों में बहुत ही खतरनाक है। आओ जैसे निकालिए अते इकट्ठे होकर ट्रांसफैट मुक्त पंजाब बनाइए।
मैं बेअंत सिंह इंटरनेशनल एथलीट आप सब का साथ मंगता हाँ अते अपील करता हाँ आओ ਆਪਾਂ ਸੁਰੱਖਿਅਤ ਅਤੇ ਸ਼ੁੱਧ ਭੋਜਨ ਦੀ ਮੰਗ ਕਰੀਏ। ਘਰੇਲੂ ਵਰਤੋਂ ਲਈ ਬਨਸਪਤੀ ਤੇਲ ਖਰੀਦਦੇ ਸਮੇਂ ਉਸ ਦੇ ਉੱਪਰ ਦਿੱਤੇ ਗਏ ਲੇਬਲ ਤੇ ਟ੍ਰਾਂਸਫੈਟ ਜ਼ਰੂਰੀ ਚੈੱਕ ਕਰੋ। ਟ੍ਰਾਂਸਫੈਟ ਮੁਕਤ ਦੀਵਾਲੀ ਦੇ ਹੱਕ ਵਿੱਚ ਹਾਂ ਅਤੇ ਤੁਸੀਂ।
मैं इस दिवाली के मौके पर शुभकामनावां दिंदी हुई सेहतमंद पंजाब सिरजण लई कुछ कहना चाहती हाँ कि ट्रांसफैट बहुत ही बुरी फैट है जो कि दिल दीयां बीमारियां दा कारण बनती है। आओ असीं रल के इस नूं निकारदे होए ट्रांसफैट मुक्त पंजाब बनाउण दा वचन दईए।
फ्रेंड्स, मेरा नाम दिनेश मोहन है और मैं एक सीनियर एज एक्टर और मॉडल हैगा और सब लोग जानते हैं कि मेरा वेट पहले 135 kg सी और उन्हें लूज करके मैं 80 किलो ते लेके आया और उस तो बाद मैंने मॉडलिंग और एक्टिंग करने दिया ऑफर्स आई हैं। ਇਹ ਵੀਡੀਓ ਮੈਂ ਤੁਹਾਨੂੰ ਇੱਕ ਸਪੈਸ਼ਲ ਰਿਕੁਐਸਟ ਕਰਨ ਵਾਸਤੇ ਅੱਜ ਬਣਾ ਰਿਹਾ ਕਿ ਤੁਸੀਂ ਲੋਕ ਜਾਣਦੇ ਹੋ ਕਿ ਟ੍ਰਾਂਸ ਫੈਟ ਜੋ ਹੈ ਉਹ ਇੱਕ ਬਹੁਤ ਹੀ ਬੁਰਾ ਫੈਟ ਹੈ ਔਰ ਸਾਡੇ ਦੇਸ਼ ਵਿੱਚ ਉਹ ਹਾਰਟ ਅਟੈਕਸ ਦਾ ਔਰ ਦਿਲ ਦੀਆਂ ਬਿਮਾਰੀਆਂ ਦਾ ਮੇਜਰ ਕਾਰਨ ਬਣਦਾ ਹੈ। ਤੇ ਮੈਂ ਤੁਹਾਨੂੰ ਸਭ ਨੂੰ ਰਿਕੁਐਸਟ ਕਰਨਾ ਚਾਹੁੰਦਾ ਕਿ ट्रांस फैट फ्री चीज़ा खाओ, साफ सुथरा खाना खाओ, हेल्दी खाना खाओ, अच्छा खाओ पियो और अपने आप को सुरक्षित रखो और अपनी फैमिली को भी सुरक्षित रखो। मैं दिनेश मोहन ए प्रण लेना कि मैं ट्रांस फैट फ्री पंजाब बना के रहांगा। तुसी की कहंदे हो?
And on this Diwali, I urge everybody to have a trans fat free Diwali. And by this I mean that you should have only products which have less than 2% of trans fat. Myself have a very prosperous and a happy Diwali and a trans fat free Diwali.
मैं सारे जो दोस्त मित्र ने उन्होंने दिवाली दी मुबारकां दिना ते एक मैं नसीहत भी देना चाहना क्योंकि PGI ने एक बहुत अच्छी मुहिम शुरू की है जी ट्रांस फैट जी बुरी फैट है उन्होंने कंट्रोल करने वास्ते तुसी मिठाइयां नहीं ज़्यादा खानियां ते तुसी फ्राइड जिहड़ा खाना है या फ्राइड जिहड़ियां चीज़ां ने वो नहीं खानियां ते अपनी सेहत का ख्याल रखो और कोशिश करो कि इन्हां चीज़ों को घट तो घट वरतों विच लियाओ उन्ना ही खाओ जिन्ना तुहानूं जरूरत है ते इस मुहिम नूं मैं सपोर्ट करदा इस मुहिम दे नाल हां।
सत श्री अकाल जी, मैं ਤੁਹਾਡਾ ਆਪਣਾ ਬੱਬਲ ਰਾਏ ਤੇ ਇਸ ਵਾਰੀ ਮੈਂ ਦੀਵਾਲੀ ਦੇ ਉੱਪਰ ਤੁਹਾਨੂੰ ਬਹੁਤ ਖਾਸ ਅਪੀਲ ਕਰਨੀ ਚਾਹੁੰਦਾ ਕਿ ਇਸ ਵਾਰੀ ਦੀਵਾਲੀ ਨੂੰ ਆਪਾਂ ਘੱਟ ਤੋਂ ਘੱਟ ਟ੍ਰਾਂਸ ਫੈਟ ਵਾਲਾ ਫੂਡ ਹੈ ਜਿਹੜਾ ਖਾਈਏ। ਬਾਹਰੀ ਜਿਹੜੀ ਮਠਿਆਈਆਂ ਉਹਨਾਂ ਨੂੰ ਖਰੀਦਣ ਤੋਂ ਗੁਰੇਜ਼ ਕਰੀਏ ਤੇ ਜਦੋਂ ਵੀ ਆਪਾਂ ਕੋਈ ਕਿਸੇ ਸਟੋਰ ਦੇ ਉੱਤੋਂ ਵੀ ਕੋਈ ਆਈਟਮ ਖਰੀਦਦੇ ਆ ਤਾਂ ਉਹਦੀ ਟ੍ਰਾਂਸ ਫੈਟ ਪਰਸੈਂਟੇਜ ਹੈ ਜਿਹੜੀ ਉਹ ਜ਼ਰੂਰ ਚੈੱਕ ਕਰਿਆ ਕਰੋ ਕਿਉਂਕਿ 2% ਤੋਂ ਘੱਟ ਹੋਣੀ ਚਾਹੀਦੀ ਹੈ ਤੇ ਉਹੀ ਆਪਣੀ ਸਿਹਤ ਨੂੰ ਜ਼ਿਆਦਾ ਨੁਕਸਾਨ ਕਰਦੀ ਹੈ। ਸੋ ਆਓ ਰਲ ਕੇ ਇਸ ਦੀਵਾਲੀ ਨੂੰ ਟ੍ਰਾਂਸ ਫੈਟ ਮੁਕਤ ਬਣਾਈਏ। ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ।
You to avoid all those food products which contain trans fat and also avoid unhealthy sweets. Nutrition label: trans fat should not be greater than 2% of energy intake. Wishing you a very happy and prosperous Diwali. I support trans fat free Diwali campaign. Do you?
Which have less than 2% of trans fat. So while buying your cooking oil, Vanaspati, just make sure that the percentage of trans fat is less than 2%. I wish you all a very happy and prosperous Diwali. And remember, you celebrate a trans fat free Diwali.
बेनती करना चाहनी हाँ इस साल दिवाली ते let's have a trans fat free दिवाली एक कैंपेन है जी PGI ने शुरू की है। वो चाहते ने कि आप जदों भी बाहरों कोई स्वीट्स ले कोई भी मिठाई ले it shouldn't be unhealthy for our body ते just एक बारी चेक कर लियो कि 2% तो ज़्यादा ना होए वो intake the trans fat intake।
इस दिवाली ਤੁਹਾਨੂੰ ਸਾਰਿਆਂ ਨੂੰ ट्रांस फैट फ्री भोजन पदार्थ खाने की अपील करनी है। आओ असी सारे मिलकर अपनी सेहत का ध्यान रखिए ते इन्हां सारे तले हुए या मिठाइयां या जिन्ने भी होर भोजन पदार्थ ने जिन्हां विच ट्रांस फैट बहुत ज्यादा अमाउंट होता है उन्हां नूं त्यागिए ते अपनी सेहत का ध्यान।
On this Diwali, I urge you to avoid all the food products which contains trans fat. Also avoid the unhealthy sweets. While buying the Vanaspati, edible oils, fats, must check the trans fat. It should not exceed 2% of that.
Diwali, सारे मिलते हैं बहुत अच्छा त्योहार है ते ऐसी जनता की बहुत ते सारे आप रल मिल के जो बाहर का खाना खाना चाहिए चेक कर ਚੈੱਕ ਕਰਦੇ ਹਾਂ ਟ੍ਰਾਂਸਫੈਟ ਤੇ ਇਹ ਜੋ ਕੈਂਪੇਨ ਹੈ ਇਹ PGI ਵੱਲੋਂ ਹੈ ਜੀ ਫ੍ਰੀ ਦੀਵਾਲੀ ਟ੍ਰਾਂਸਫੈਟ
ਸਾਰੇ ਦੋਸਤਾਂ ਨੂੰ ਦੀਵਾਲੀ ਦੀ ਬਹੁਤ ਬਹੁਤ ਸ਼ੁਭਕਾਮਨਾਵਾਂ ਟ੍ਰਾਂਸ ਫੈਟ ਸ਼ੁਡ ਨਾਟ ਬੀ ਮੋਰ ਦੈਨ 2% ਇਹ ਸਾਨੂੰ ਕਾਊਂਟ ਕਰਨਾ ਪੈਣਾ ਸੈਕੰਡ ਮੈਂ ਚਾਹੁੰਦਾ ਕਿ ਜਿਹੜਾ ਪੰਜਾਬ ਹੈ ਇਟ ਸ਼ੁਡ ਬਿਕਮ ਟ੍ਰਾਂਸ ਫੈਟ ਫ੍ਰੀ ਪੰਜਾਬ and I pledge to celebrate Diwali as trans fat free Diwali.
I urge you all to consume products without trans fat. While you're consuming and while you're purchasing your oils, vanaspati oil, edible oil, etc., go take a look at the label. The trans fat intake of the total energy must be less than 2%. This Diwali, I support PGI's campaign of a trans fat free Punjab. What about you?
Hi guys, my name is Priyanka and by profession I'm a yoga therapist and a public health specialist. Okay, so I'm going to tell a few basic postures of yoga plus 2-3 pranayams which you can perform easily at home and can get rid of these high cholesterol level and also reduce the risk of CBDs. Asana is Vajrasana. So you turn sideways, stretch your arms up, slowly exhale down, up. Second is Ardha Chandrasana.
5-7 मिनट बस
You fold one leg.
नहीं बस थैंक्स करना
Bend this leg. Breathe in. Hold it and turn back. Asana is Chakrasana. So you lie down on your back. Shalabhasana. So you lie down on your abdomen. And straight arms, slowly breathe in and down, relax.
But you want to avoid foods that contain trans fats. Also avoid unhealthy sweets. While buying food products, edible oils, please check the food labels on them. Please check the level of trans fats and these should not exceed 2% of the total energy. We support the Trans Fats Free Diwali campaign by PGI Chandigarh.
मैं डॉक्टर राणा सिंह डायरेक्टर कार्डियोवैस्कुलर हमारी खुराक के अंदर ट्रांस फैट्स की मात्रा कम से कम होनी चाहिए ट्रांस फैट की वजह से दिल की बड़ी घातक बीमारी हो सकती है और हम सबको उससे बचना है
all of you to celebrate a trans fat free Diwali. How? Avoid food products that contain trans fat. Also avoid processed and unhealthy sweets. Whenever you go out to market to buy edible oils, please make sure that the trans fat limit should not exceed 2% of the total energy consumption. I am supporting this movement run by PGI.
On this Diwali, I want to tell you that you should not take unhealthy food. Say no to trans fat. So what is this trans fat? This trans fat is bad fat. How you can know that your food which you are buying, like you're buying an edible oil, you're buying a vanaspati oil, whether it contains trans fat or not. You have to just check it. Whether the trans fat concentration is mentioned or not. If mentioned, it should not be more than 2%. So we have to take less than 2% of trans fat, edible oil or other fat products.
Urge to avoid all the food products contain trans fat. So while buying vanaspati, edible oils and sweets, kindly check the fat limit and it should not be greater than 2% of total energy intake. So I support this trans fat free Diwali campaign which is organized by PGIMER Chandigarh.
The trans fats are a form of unsaturated fats and are notoriously unhealthy fats for us. And these fats are found in many of products like biscuits, cakes, cookies, pizza dough, pizza crust, microwave popcorns, coffee creamers, and many more. Trans fats are really bad for our health. They actually increases our LDL level, which is a bad cholesterol, and decreases HDL level, which is a good cholesterol, leading to weight gain, obesity, hypertension, diabetes, heart attack, and heart stroke. They also alter your platelet function. They also diminishes mental performance, leading to neural degeneration. So let's become aware this Diwali to have sweets which are traditionally made at home with natural ingredients such as flaxseed laddus, gulukul barfi, pan, chocolate, coconut and akroat barfi, homemade panjiri, homemade halwa, akroat and date bites, and there is so much variety. So let's take a pledge to go trans fat free this Diwali and have a happy, healthy, safe Diwali.
Proud to be associated with the PGIMER and Global Health Advocacy Incubator for a unique initiative which is called as Trans Fat Free Diwali. Please take a pledge with me to shun all kinds of trans fat rich diet. Thank you.
I wish to make an appeal to everyone that let us say no to the food which contain the trans fat. Take a pledge that we will say big no to the trans fat food. And this Diwali we will have a trans fat free.
ट्रांस फैट फ्री दिवाली मनाइए ਤੇ ਔਰ ਇਹਨਾਂ ਤੁਹਾਨੂੰ ਸਾਰਿਆਂ ਨੂੰ ਇਸ ਗੱਲ ਦੀ ਮੁਬਾਰਕਬਾਦ ਦਿੰਦਾ ਕਿ ਤੁਸੀਂ ਇਹ ਪਹਿਲੀ ਵਾਰੀ ਇਨੀਸ਼ੀਏਟਿਵ ਲਿੱਤਾ ਹੈ ਪੰਜਾਬ ਦੇ ਸੂਬੇ 'ਚ ਇਹ ਕਰਦਾ ਜਿੱਥੇ ਕਿ ਸਾਨੂੰ ਬਹੁਤ ਲੋੜ ਹੈ ਸਾਡੇ ਬਹੁਤ ਸਾਰੇ ਜਿਹੜੇ ਪੇਸ਼ੈਂਟ ਨੇ ਜਿਹੜੇ ਹਾਈਪਰਟੈਂਸਿਵ ਨੇ ਜਾਂ ਕਾਰਡੀਅਕ ਡਿਜ਼ੀਜ਼ ਨਾਲ ਇਨਵੋਲਵ ਹੋਏ ਨੇ ਮੈਂ ਸਮਝਦਾ ਕਿ ਜੇ ਆਪਾਂ ਇਹ ਚੀਜ਼ਾਂ ਕਰਾਂਗੇ ਤਾਂ ਆਪਾਂ ਜਿਹੜਾ ਸਰੀਰ ਹੈ ਉਹਨੂੰ ਇਹਨਾਂ ਬਿਮਾਰੀਆਂ ਤੋਂ ਵੀ ਮੁਕਤੀ ਪਾ ਸਕਦੇ
कई दिनों में आप एक दूसरे को हम सीनियर को अपने रिश्तेदारों को मिठाइयाँ या तरह तरह के गिफ्ट देते हैं। फ्री दिवाली मनाने का एक निर्णय लिया है और इसमें हैशटैग ट्रांसफैट फ्री दिवाली का भी मुहिम चलाया है। इसमें हम ये जान लें कि एक दिन में फ्री तो नहीं हो पाएगा, लेकिन जो अच्छी बात है डॉक्टर सोनू और की टीम ने की है कि एक डायलॉग शुरू किया है ताकि लोग इस पे सोचना, बोलना, समझना इस चीज को शुरू करें और धीरे धीरे हम उस चीज पे आएंगे। ट्रांसफैट कम होता है, ट्रांसफैट फ्री की जो दौड़ है, जो टारगेट रखा है, उसको पूरा करने में सब लोग साथ मिलकर काम करें।
मैं कुमार राहुल, फूड एंड ड्रग कमिश्नर ਪੰਜਾਬ ਦੇ ਸਾਰੇ ਨਗਰ ਨਿਵਾਸੀਆਂ ਨੂੰ ਬੇਨਤੀ ਕਰਦਾ ਹਾਂ ਕਿ ਜਿਹੜਾ ਤਿਉਹਾਰਾਂ ਦਾ ਸਮਾਰੋਹ ਹੈਗਾ ਤੁਸੀਂ ਟਰਾਂਸ ਫੈਟ ਜਿਵੇਂ ਕਿ ਜਿਹੜੇ ਤਲੇ ਹੋਏ ਖਾਦ ਹੁੰਦੇ, ਖਾਦ ਪਦਾਰਥ, ਮਿਠਾਈਆਂ ਹੁੰਦੇ ਤੇ ਰੀਹੀਟਡ ਜਿਹੜੇ ਹੁੰਦੇ, ਤੁਸੀਂ ਆਮ ਹਲਵਾਈ ਕੋਲ ਜਾਂਦੇ ਹੋ ਉੱਥੇ ਦੇ ਬੰਦਾ ਬਾਰ-ਬਾਰ ਇੱਕ ਹੀ ਤੇਲ ਦੇ ਵਿੱਚ ਤੁਹਾਨੂੰ ਬਾਰ-ਬਾਰ ਸਮੋਸੇ ਬਣਾ ਕੇ ਦੇ ਦਿੰਦਾ। ਇਸ ਤਰ੍ਹਾਂ ਦਾ ਖਾਣ ਪੀਣ ਤੋਂ ਪਰਹੇਜ਼ ਕਰੋ, ਤੁਹਾਨੂੰ ਤੁਹਾਡੇ ਲਈ ਹੈਲਥ ਲਈ ਬਿਲਕੁਲ ਠੀਕ ਨਹੀਂ ਹੈਗਾ। ਇਹ ਜਿਹੜਾ ਦਿਲ ਦੀ ਬਿਮਾਰੀ ਹੈ ਤੇ 50 ਤਰ੍ਹਾਂ ਦੀ ਹੋਰ ਵੀ ਸਰੀਰ ਨੂੰ ਨੁਕਸਾਨ ਹੋ ਸਕਦਾ ਤੇ ਮਨੁੱਖੀ ਸਿਹਤ ਲਈ ਇਸ ਤਰ੍ਹਾਂ ਦਾ ਤੇਲ ਤੇ ਇਸ ਤਰ੍ਹਾਂ ਦਾ ਜਿਹੜਾ ਫਰਾਈਡ ਖਾਣਾ ਬਿਲਕੁਲ ਠੀਕ ਗੱਲ ਨਹੀਂ ਹੈ। ਤੇ ਮੈਂ ਇਹ ਦੀਵਾਲੀ ਦਾ ਜਾਂ ਤਿਉਹਾਰਾਂ ਦਾ ਸਮਾਂ ਹੈਗਾ, ਅਸੀਂ ਬਿਲਕੁਲ ਖੁਦ ਹੀ ਪਰਹੇਜ਼ ਕਰੀਏ ਤੇ ਆਲੇ ਦੁਆਲੇ ਪਰਿਵਾਰ ਦੇ ਮੈਂਬਰਸ ਨੂੰ ਵੀ ਅਸੀਂ इस तरह के खान पीन तो मना करिए। धन्यवाद।
Thank you very much. I thank all the ambassadors and the supporters who have actually made this campaign a success. So thank you very much again. So not taking much of time, I will just announce that we have been continuously sharing the social media handles link on the YouTube chat box. You can just click on the link and follow our pages and can access to our previous events and the live event which is going on. Also, please fill the form regarding the assessment of knowledge and practices regarding trans fat that is also being shared in the in the chat box, in the YouTube chat box. So now I invite Dr. Sonu Goyal to please announce the contest winners during the trans fat free campaign and release the report. Over to you, sir.
So it is my proud privilege to release to announce the winners of the competitions. As I already briefed that more than 150 schools of Chandigarh has participated, and we received almost 1,000 plus entries in different categories. So we had 3 categories. So in category 1, that is slogan writing, the third prize goes to Rituraj. He is in 10th class of Government Medical School, Government Model High School in Sector 32. Second prize goes to Babita, again in 10th class, and again Government Model High School. And the first prize of slogan writing goes to Divyanshi of 5th class of Tender Heart Manav School. So these are the, and we congratulate the winners of those this thing. And we have a consolation prize also in slogan writing, that is Ranjit, class 10th of Government Model High School, Sector 25. Then we had a poster making competition, and the first prize in poster making competition, a very beautiful poster you can see on the left hand side, goes to Manav of 7th class in Tender Heart Manav School. The second prize of poster making goes to Isha, 9th class, a beautiful poster you can see, don't rot your body, say no to trans fat. And Isha is from 9th class, Government Model Senior Secondary School, Sector 28. And the third prize goes to Rituraj again, 10th class, Government Model High School, a very beautiful, I can't believe that a school student has done a very beautiful drawing. It looked like an art student of Sector 32D, Chandigarh. And the consolation prize goes to Sanjana, 9th class, Government Model High School, Sector 25. Your fast food can be your last food. And then we had a jingle making, lot of jingles came to us, and this was the jingle by Himanshu, 9th A, Government Model High School, Deep Jalao, Deep Jalao. So this is a very beautiful jingle which also talks about what to eat, what not to eat. Then second prize, Mandeep, 9th class of Government Model High School, Sector 28C, पल पल सुनहरे फूल खिले, कभी ना हो कोरोना का सामना, जिंदगी आपकी खुशी से भरी हो, दिवाली पर यही शुभकामना. So this is something which is related to the current context too. And the third prize goes to Dolly, 10th class, Government Model High School, Sector 28. So these were our contest winners. Now we had circulated this among the government of Punjab has circulated this campaign to all the 300 plus health and wellness center, and all the health and wellness center had done lot of events in their places. And again, we received lot of entries from there, and we selected few contest winner in terms of the centers. And this is the first center. First prize goes to Bhalri Roopnagar, Ropar. So this was the first prize goes to Bhalri Roopnagar. And the second prize goes to sub-center Saneta, District Mohalli. And the third prize goes to center Akliya in District Mansa. We have lot many competitions, but this was selected by the state of Punjab, and we were sent these 3 winners of 3 prizes. So these were our winners, and we will be sending them the cash prizes to the respective center or to the respective students. Now I am really happy in front of all the dignitaries, happy to release the report of our trans fat free Diwali campaign. And this report is a very elaborative report which showcases all the work which is being there. And so I request all the dignitaries present over here to say release for the report. It showcases all the activities which we have done, which we have summarized. And it's a very long, I think 100-page report on various activities, what are the strategies we adopted, and what are the events being conducted, how we planned that event. So very detailed report prepared by our staff. So I request all of the dignitaries say release at one go after me. Release.
Release.
Release. Release. Great. Thank you very much. So this is the report. This is the front page of the report. We can see the releases. We can see some of the events on the front page. And that report will be displayed on our social media handles that has been circulated. And this is the pledge. I think we have already done that pledge section. Dr. Rakesh Gupta has also I support Trans Fat Diwali campaign. So this was the pledge which was taken by many of the centers. These are our social media pages. Those who are listening on the YouTube and also those experts who are on Zoom can follow our YouTube page. We have YouTube page PGICVH Cardiovascular Health, or we have this Twitter also at the rate PGI_CVH. We have Facebook page, PGI CVH page, and we have a resource center for cardiovascular health, in which you can find a lot of resource related to cardiovascular health under the project. We have at the global level and at the national level. So now I would like to invite Mr. Arun Verma, Director Operation, who is the former Director Distribution, Punjab State Power Corporation and Managing Director of Dakshin Haryana Power Corporation, to deliver the vote of thanks. Thank you.
Thank you, Dr. Sonu. Very good afternoon to one and all. I feel privileged and honored to propose this vote of thanks to all the dignitaries, as well the battery of technical experts on the trans fats and other field of their operations. On behalf of Department of Community Medicine, School of Public Health, SIPHER and Global Health Advocacy Incubator, GHAI. First of all, I thank Dr. Amarjeet Singh, Professor and Head of Department of Community Medicine, School of Public Health, PGIMER, for a very nice welcome address and motivating the team. Sir, we are extremely grateful to you for your ever-ready and overall support in all our endeavors. I thank Dr. Sonu Goyal, Professor, Department of Community Medicine and School of Public Health, PGIMER, for sharing details on the trans fat campaign so nicely. A big thanks to Dr. Sonu Goyal for creating an exhaustive and self-explanatory documentary, as well as beautiful videos transmitting great information and message on the bad effect of trans fat on our health. My special thanks to Ms. Mehak Chauhan, RJ Radio Mirchi, 98.3 FM, for her immense contributions in making our campaign successful by sharing it with millions of listeners and fans of Radio Mirchi. I'm also one of them. Thank you, Madam, for creating an awareness among the public. My special thanks and big thanks to all our guests of honors and esteemed technical experts on the subject who have made immense contribution in their field of working. I thank them for sharing great knowledge they have with our audience. Dear Dr. Umesh Kapil, Professor and Dr. Ravi Mehrotra, Dr. Rana Jay Singh, Dr. Sanjay Jotte, Dr. Sanjay Kerai, Dr. Rubina Shaheen, Dr. Hemlata, and Dr. Gurpreet Singh. My thanks to Dr. Om P. Vera, Country Coordinator, GHAI, for presenting an overview on the status of the trans fats. My thanks also to Ms. Parul, who couldn't join, the correspondent in Indian Express, for her media perspective on the trans fats free Diwali campaign. I thank Dr. Rakesh Gupta, President, SIPHER, and the former Director, Punjab, for overall planning and coordination of this event at all levels in organizing this valedictory ceremony. My also thanks to our ambassadors for the campaign on the trans fats, and the few of them are Flying Sikh, Shri Milkha Singh ji, with whom I play golf, Mr. Jassi, Mr. Babal Rai, Mr. Lember, Hussain Puri, Dinesh Mohan, Sahil Anand, Gurinder Makhan, Preet Kamal, and many others. My thanks to our dedicated team for their immense contribution in making this event happen. Dr. Nidhi, Dr. Kritika, Dr. Poonam, Dr. Meenal, Mr. Arshdeep, Rajiv, Saurabh, Berlin, and Surbhi. Last but not the least, my thanks to all our audience who have joined this event on the YouTube. My congratulations to Dr. Kritika for comparing this event so excellently. My congratulations to the entire team of PGIMER, GHAI, and SIPHER for the success of this campaign. Thank you, one and all, once again. Thank you very much.
Thank you very much, sir. Thank you for vote of thanks, which has been celebrated very nicely. And I again thank everybody for being a part of this very worst tobacco trans fat free campaign. And before we leave, I just wanted to tell you that how can we forget to take a group photograph? I request our that please mute yourself once and please switch on your camera so that we can have a group photograph. Yeah. Dr. Rubina, if you can just switch on your, yeah. Miss Shipra Saklani, Dr. Rana, Dr. Sonu. I request our team to please have a group photograph. I hope you have taken it, Saurav.
Yes, ma'am.
Thank you very much. And I thank again everybody for being here and watched our live session on YouTube and who have been watching this continuously for the whole time. And all our ambassadors, our experts, our team members, Dr. Sonu, Dr. Meenal, Dr. Rakesh Gupta, Dr. Khanna for being motivating, and my team members without whom we have not been able to successfully complete this campaign. So thank you very much. And I again wanted to say that please follow our pages. Thank you very much.
So thank you team. Thank you all.
Thank you, sir. Thank you.
Thank you.
Thank you, everyone.